Welcome on this lovely evening to the University of Melbourne. My name is Mike McGuckin. I'm the Acting Dean for the Faculty of Medicine, Dentistry and Health Sciences here at the University of Melbourne. And it's great to be here in the lead up to International Women's Day next week to celebrate Priscilla Kincaid-Smith, who was the first female professor at the University of Melbourne. And we're celebrating it with this 11th annual oration on health that's been named in her honour. Before we begin, I'd like to acknowledge that the university is sited here on unceded lands of the Wurundjeri people of the Kulin Nation, and pay respects to elders past, present and emerging, and particularly to any First Nations Australians who have joined us here today. Yesterday, just over in the student precinct, we held Wominjeka smoking ceremony to welcome the students back to the start of the academic year. The campus has been bustling in the last week. It's hard to get around. There's pesky students everywhere you want to walk, but we are a university. Social networks and community wellbeing and resilience is the subject of today's oration, and as the oldest continuous culture on earth, Indigenous Australians have shown their resilience through their strong connections to country, culture and community. And so too, the faculty's impact and its success is due to our connections with many partners across biomedical research institutes, hospitals and health providers, community, government, industry and philanthropy. And on the 150th anniversary year of the Faculty of Medicine, Dentistry and Health Sciences, we are celebrating the transformative partnerships that have advanced health, discovery, education and care in Australia and around the world. And we also acknowledge in this year that parts of our history have caused harm to Aboriginal and Torres Strait Islander peoples. We're not shying away from this troubled history and will continue the university's commitment to truth-telling that was exemplified in the Doombak Gubgawana books, 2 volumes that detail some of this history of the university with First Nations people. And we'll also celebrate initiatives that have led to improved health outcomes for Aboriginal and Torres Strait Islander communities, while continuing to try to address what are still very unfortunate gaps in Indigenous health. So today's oration is an opportunity to remember and recognise Priscilla Kincaid-Smith and to highlight the exceptional work of contemporary female health professionals. Professor Kincaid-Smith was a renowned specialist in kidney disease. We've got someone in the audience whose aunt was treated by Priscilla. And she was a pioneering leader in research and clinical care, a fearless patient and public advocate, and the first female professor at the University of Melbourne. You would have thought that was centuries ago, but no, it was in our somewhat recent history. And she was a role model and mentor to many. She's well known for discovering the link between compound analgesics, such as Beck's and Vincent's powder, and kidney damage, and for her research on renal disease and efforts to prevent renal failure. I'm one of the older people in the audience here, and I can remember when my grandmother was kind of hooked on Beck's powder, and I can remember the advertisements which were targeting women and telling them to have a cup of tea, a Beck's and a good lie down. And there's so much wrong with that. It's hard to comprehend in this day and age, but that was it. And Beck's was loaded with aspirin and phenadicin, which caused the kidney disease together, and also with caffeine to make it addictive. I mean, it's a terrible story, really. And Priscilla unlocked the connection between these drugs that were targeted to particularly to women in the community in kidney disease. So she was a trailblazer in many senses. She was the first female president of the Royal Australian College of Physicians. I bet that was a interesting time in selecting her in that day and age. The first female chair of the Australian Medical Association, the first female and Australian chair of the World Medical Association, and also the International and Australasian Societies of Nephrology. So she really was a trailblazer. And by stepping into these roles and establishing and nurturing strong national and global links, she harnessed the power of these partnerships and networks to advocate for policy changes to deliver and improve health services. In the faculty's 150th year, Priscilla Kincaid-Smith is a shining example of someone who, through partnership, changed the course of healthcare, demonstrating how much can be achieved when people come together with a shared purpose. This year, I'm delighted that Priscilla Kincaid-Smith Oration will be delivered by Professor Pip Pattison AO. And in a moment, I'll invite Pip to deliver today's oration, and then after that, our own Lisa Gibbs is going to join Pip in a conversation and some audience Q&A. And after that, we've got some refreshments, and we invite you all to stay around, meet with Pip and meet others and have an enjoyable time. And so our orator today, Pip Pattison AO, is an emeritus professor at the University of Sydney, where she held the role of Deputy Vice-Chancellor Education until 2021, and also has an extensive history at the University of Melbourne. I hadn't met Pip before tonight, but many of you in the audience will know Pip very well for her leadership roles she held, and is a well-known and highly respected quantitative psychologist who has pioneered the use of mathematical and statistical models for social networks and network processes, and has shown the relevance of mathematical psychology to many outside the field. Pip began her educational career and journey with us here at the University of Melbourne, obtaining a BSc Hons in 1973, and she became a lecturer in the Department of Psychology in 1977, while she was completing her PhD in psychology, graduating in 1980. She was promoted to professor in the Department of Psychology in the year 2000, and has spent much of her career in the School of Psychological Sciences before taking on her academic leadership roles, including being the Deputy Vice-Chancellor Academic here at the University of Melbourne from 2011 to 2014. Then she joined the University of Sydney, as I said, as Deputy Vice-Chancellor Education. She was honoured with an Officer of the Order of Australia in 2015, is a Fellow of the Academy of Social Sciences in Australia, the Royal Society of New South Wales, and the Network Science Society. And nowadays, Pip chairs the University of New South Wales College Board, is a member of the Higher Education Standards Panel, and a part-time senior advisor at Swinburne University. Pip's research focuses on the development and application of mathematical and statistical models for social networks and network processes. Her work has broad application from tracking the spread of infectious diseases to following the recovery of communities after the 2009 Victorian bushfires. And her work has been funded by competitive grants here and from the US. She's published several books and numerous chapters and scholarly papers, and also regularly invited to speak to international conferences. She supervised more than 30 PhD and D-Psych graduates. So we have an esteemed person in our presence, and Pip, very appropriate person to deliver the 2026 Priscilla Kincaid-Smith Oration for Health, entitled Social Networks and Community Wellbeing and Resilience. So let's welcome Pip.
Thank you very much, Mike. It's a real honour to be part of this special event to honour Priscilla Kincaid-Smith. I never met Professor Kincaid-Smith, but I've been inspired by her for a very long time. She was an exceptional scientist and a pioneering change maker, as we've heard. And you've heard a lot about mathematical and statistical models. No equations this evening, I promise. I've spent most of my academic life, though, exploring and seeking to model the role of social connections and the networks that they form in the ebb and flow of social life. I've been extremely fortunate to work with others on this, and I'd like to acknowledge up front the contributions of those whose work I'll be touching on this evening. And many of them are here tonight, which is really lovely. But let me start first by talking about social connections and wellbeing. The importance of social connections to health and wellbeing is now well accepted, with established associations among three broad concepts: social connections of an individual to those in their environment, the sense of feeling connected or belonging to a group or community, and wellbeing, including mental and physical health, but also broader indicators of thriving. I've included belonging as well as social connections because they're related and because many studies focus on one or the other or both, and they probably have slightly different roles to play. And while these three concepts are defined and measured in a diversity of ways, numerous reviews and meta-analyses have affirmed a positive relation between each pair. Perhaps more significantly, from a practical perspective, there's also many analyses pointing to a positive impact on wellbeing, first of efforts to increase social connections, and second of efforts to increase a sense of connection or belonging. Social connections and belonging, therefore, offer promising opportunities for interventions to improve wellbeing. I'll give a quick flavour of three effective forms of intervention before bringing social networks more directly into the picture. First, many initiatives designed to create new social connections seek simply to increase the opportunities for social connection. You can't make people like each other. But that recognises that increased social connection will emerge endogenously from increased interaction. For example, a study at a Swiss university demonstrated the impact of a 2-hour introductory event prior to course commencement, which not only seeded the development of social connections within the cohort, but also created greater diversity of social connections amongst the cohort through the random allocation of students to small groups at the introductory event. Those initial groups were strongly reflected in the initial measurement of the social network amongst students, and as the network grew and evolved, friendship ties spawned study together ties that were ultimately associated with shared student success. A small effort for quite a significant outcome. Second, initiatives designed to build belonging, which have focused primarily on commencing secondary students or university students, have sought to reframe students' concerns about belonging in a new educational setting as a natural but short-lived experience. The intervention is brief, can be self-administered online, and involves students reading survey results and stories from other students showing that worries about belonging are common and decrease over time, and writing a message to help future students as they commence a similar transition. This simple intervention has been shown to change how commencing students make sense of their own transitional situation and encourage greater uptake of opportunities for success that are already available to them in their new environment. Indeed, a series of studies initiated by Stanford psychologists Greg Walton and Jeffrey Cohen established that these brief interventions improved persistence at university, academic success, and on later follow-up, career success and civic engagement. A recent large multi-institutional randomised control trial published by Walton and others demonstrated that the intervention increased the rate at which students completed first year as full-time students, especially those in groups that had historically progressed at lower rates. They also identified important institutional factors moderating the impact of the intervention. A third form of intervention, intended for individuals who perceive social situations as threatening, is a psychological intervention to build interaction skills. This has also been successful, especially when offered in a group setting. Increased skills for interaction enable increased social connections and an increased sense of belonging. These interventions offer promising avenues for improving wellbeing in communities in general and in student communities. However, the picture I've painted so far is one built by studying individuals in isolation, even though social connections are part of the story. A more contextualised approach to understanding social connection, belonging and wellbeing is supported by case studies and qualitative analyses that suggest all three broad concepts are best seen as dynamic and in flux, and that interactions in networks matter. In the educational context, students themselves clearly identify connections with others as the means through which a sense of belonging is developed, and they refer not just to those who might already be or become friends and peers, but also to interactions with teachers, other staff, and less regular contacts. So this brings us to social networks. At their simplest, social networks comprise a set of nodes, often representing individuals, and a set of social connections or network ties among them. Interest in social networks is driven by the capacity of networks to inform our understanding of individual social contexts, and also of how interactions in networks accumulate into community level outcomes. Of course, social networks of interest are often much larger. Here, for example, is a fragment of a community network constructed by snowball sampling. The initial sample of community members, coloured yellow in the diagram, was a random sample of working age adults in a Melbourne suburb. These community members my finger on the wrong button. Oh, there we go. So, the yellow ones are the initial sample. They identify close contacts, coloured green in the diagram, who were then invited to participate as respondents. They in turn nominate their close contacts, coloured red. The community members, coloured red, also identified their network partners and the contacts among them, though these further contacts and ties are not shown in the diagram. This network is just a fragment of the full social network in that community, but it is one that we can use to understand the broader community structure. A second reason to consider social networks is that we now know that the arrangement of social ties in a network can be important, as well as the number of their social connections. For example, the diversity of an individual's network partners has been linked to wellbeing and success in educational settings, including critical thinking, cultural awareness, and the capacity to work productively with others. Having a denser social network, and hence one in which network partners are more often connected to each other, is often associated with higher levels of wellbeing. Bridging ties in a network that link to more diverse others can be a source of more diverse information, such as job opportunities, famously. And then participating in both denser parts of a network and in bridging ties is linked to success in the workplace, over and above each alone. And the concept of depth of connectivity or nestedness in a network, how many people you have to remove from the network to disconnect a person, that's been linked to greater school attachment, over and above the number and density of connections and the involvement in bridging ties. In other words, while the number of an individual's close contacts is important, there's more to learn about how exactly social connection relates to belonging and well-being. So how can we model this situation? The key, many of us contend, is to focus not just on individuals, but on an ensemble of individuals within their connected social contexts. And that means studying networks. This could also mean including the groups in which people participate. Indeed, many social scientists now argue that the social world is best construed through a multi-level, dynamic, relational, and indeed also cultural lens. In this view, each observation is seen not just as potentially dependent on its social context, but also as providing social context for those observations in its neighbourhood. I'll give a brief snapshot of what taking this more relational perspective entails, and then focus on a case study which involved some of us here at the university. To start simply, we might observe a set of individuals and their relationships and consider two kinds of variable qualities. Variable qualities of the nodes, such as sense of belonging or well-being, and variable qualities of social connections, e.g. reflecting the presence or absence of social connections between specific individuals or connections of different kinds. The development of models for this approach to parsing the social world has depended on several insights. The first is that we cannot assume that all of these variable qualities are independent of one another. Rather, they're likely to be neither fully independent nor fully interdependent. We therefore seek to model them as an ensemble, borrowing approaches that were originally developed in statistical physics and then used in plant ecology to deal with potential dependencies. Wrangling the dependencies into a fruitful mathematical form has taken our community some time, but to cut a long story short, and this is the second point, we've learnt that dependencies among these variable nodes and qualities and tie qualities are generally quite local in a network sense, primarily, but not entirely, involving qualities that are neighbours. Interestingly, the emergence of network ties can serve to catalyse additional dependencies, meaning that the interdependencies are themselves dynamic. A third point, and a consequence of local dependencies, is that we can and should ensure that we collect sufficient data on the local context of observations we seek to model. The snowball sampling approach is often appropriate for this purpose, and the last wave of data collection can serve as context for earlier waves, even though it cannot itself be modelled. Finally, in denser regions of the network, we've found that the impact of local dependencies is attenuated where they are overlaid in close proximity. I won't go into detail, but it's a necessary insight. So what form do these dependencies take? Here's a few possibilities. Each possible dependence is associated with a different narrative for possible relational processes. On the left, the tendency for individuals with certain qualities to have more social connections or not. On the right, the tendency for interpersonal ties to cluster around common individuals or not. And of course, there's more, each with its own relational narrative as well. In the first row, the tendency for social ties to be associated with individuals who share a specific characteristic. The tendency for individuals with a specific characteristic to have more connections. The tendency for social ties to form clustered structures. In the second row, a tendency for higher levels of clustering around individuals with a specific characteristic. Or a tendency for distinct social ties to be conditionally dependent when they occur in an environment already rich in ties. In the first case, creating more open network cycles. In the second, allowing the development of boundaries or bridges around groups. I won't show the model itself. As I said, I've committed to an equation-free evening, but model parameters quantify the propensity for these various dependence-related configurations to occur. For example, and I'm done with my little theory bit, in this community network, the network structure itself is well represented by the propensity for ties to be sparse in general, more likely among geographically close individuals, well distributed across the network rather than focused around a few individuals, and clustered. We can also model the entire ensemble of node and tie variables, or the distribution of individual characteristics as a function of the network. This is the same fragment of the community network we just saw before, but the nodes are now coloured according to employment status. The red nodes are unemployed individuals and blue employed. Modelling, and people actually laid out in their approximate geographical residential location. Modelling employment status as a function of network ties, geographical proximity, and other characteristics predictive of employment status reveals that over and above the known correlates of unemployment, unemployment is associated with having fewer social connections, being connected to unemployed others, or living close to unemployed others. The approach of modelling individual status as a function of social connections was also adopted in the Beyond Bushfires project, a study of community recovery and resilience that a number of us at the university were involved in after the bushfires in Victoria in February 2009. The bushfires led to devastating loss of life and significant damage to property and the natural environment. The study was initially led by the late Professor Liz Waters, who was, many will remember, an outstanding and warmly remembered leader in our faculty, and then by Professor Lisa Gibbs, who you'll meet shortly, if you haven't already. Their superb leadership of the study was instrumental, and Lisa in particular did an extraordinary job of steering the collaboration of a large and diverse set of academics and partner organisations. I'm going to focus just on a small part of the project. In line... It's part of our life these days, isn't it? In line with prior research, the study used established measures to identify probable post-traumatic stress disorder, or PTSD, and probable depression. While the majority of impacted participants demonstrated considerable individual resilience to bushfire-related trauma, 3 years after the fires, rates of probable PTSD and probable depression were elevated in bushfire-affected areas at that time. Indeed, levels were still higher than the national average 5 years after the fires. Those with prior trauma or greater exposure were at heightened risk. Our study sought to understand how social connection and community involvement were related to outcomes for individuals and the community over and above these known risk factors. So, for probable PTSD, the study found that probable PTSD was less likely for participants whose close contacts were connected, in other words, through network density, who were nominated as close contacts by others, or were who part of a 3 cycle of close contact nominations. Probable PTSD was more likely, though, for participants who were close contacts for those who'd lost property or who served as close contact and nominated close contacts for unconnected others. Probable depression was less likely for participants whose close contacts were once again connected and who nominated close contacts, and more likely for participants whose close contacts had probable depression or whose close contacts had moved away. These results suggest that probable PTSD and depression are associated with distinctive social contexts, though being connected to other people who were close to each other was associated with lower risk of both PTSD and depression. In a separate analysis, Colin Gallagher and colleagues identified that probable PTSD was lower for those with mid-range involvement in community groups at 3 years post-fires, and that residing in a community in which a majority of people were involved in a community group was associated with an additional later mental health benefit. Although we expected and found an association between social connection and lower rates of probable PTSD and depression, we also gained new insights. That being a close contact for others was associated with lower levels of probable PTSD, whereas nominating close contacts was associated with lower levels of probable depression. That probable depression and PTSD were less likely for individuals embedded in connected structures. That probable depression and probable PTSD were differentially associated with other distinctive patterns of close contacts. That a moderate level of involvement in community groups was associated with better outcomes, and that communities in which a majority of members participated in community groups exhibited lower later levels of probable PTSD and depression. The findings underline the importance for community resilience of a broad substrate of interpersonal connectivity that touches and embeds all community members, and an overlay of community group participation that fosters the development of those social connections and ultimately binds the community together. Community members' own accounts of what promotes community resilience after a disaster identify, among other things, the value of face-to-face communication strategies, such as public events that restore or create social connections, and the rebuilding of community capacity through coordinators of volunteers. Let me now return briefly to the topic of interventions. How do we use our emerging understanding to create resilient communities, whether in local neighbourhoods or in student communities? While we still have much to learn, we already know that a community in which embedded social connections, supported through group memberships, are broadly distributed across community members has the relational substrate that community resilience appears to require. It wasn't part of our analysis, but there is probably also value for community resilience in cross-cutting group memberships that further the opportunity for cross-group social connections and ultimately social cohesion. In terms of creating connectivity and group membership, recurring opportunities for people to come together and join groups for purposeful activity are well-known ways of encouraging interaction and social connection and are widely used. Less common, perhaps, are strategies to facilitate joint activity of several groups that create opportunities to grow social connections that bridge and hence broaden connectivity and embeddedness across a community. Utilising interventions that build interaction skills are also less common, but should help to develop the desirable breadth of connectivity and embeddedness. As well, better understanding of the level and distribution of engagement with community groups could greatly assist with planning at the community level. All of these strategies applicable in both community and educational settings. Many have argued as well that interventions at multiple levels are desirable. These could include, at the community level, initiatives to create physical and organisational infrastructure for community groups, offer support to encourage community participation in groups, support collaboration among groups, monitor the distribution of community interests and participation in groups. And at the group level, a regular program of activities relevant to the purpose of the group, collaboration on meaningful cross-group activities, monitoring the effectiveness of group activities. At the individual level, support services to assist participation in community programs, including those psychological interventions I mentioned. In the university context, there's arguably some additional low-hanging fruit. Trial of the belonging interventions I mentioned earlier, and targeted orientation events designed to build social connections around course cohorts. I agree that intervening at multiple levels is desirable, though I note the caution of Schulmeister and Kawachi that we need more theory and research on cross-level interactions, or multi-level dependencies as I would term them. The recent conceptual framing of multi-level network interventions by Gary Robbins and colleagues will surely help, as will efforts to keep breaking methodological ground with studies such as the one Lisa Gibbs led. Studies adopting a multi-level, relational and dynamic perspective are hard to do and hard to do well, but they offer the prospect of a much richer understanding of how social contexts are shaped by and shape community wellbeing and resilience. Thank you.
Thank you, Pip, for delivering today's oration. I'm sure there's lots in there for everyone, from how we're dealing with our student experience, and great to have an expert in the room. We've got the head of Department of Medical Education in the front row, probably taking notes around that. I'm sure Jody saw the parallels with the infectious disease mapping and the social networks there. For me, after a bit of frank speaking at the university executive today, I'm a bit worried I'm going to be excluded from that social network and might become one of those red unemployed dots, I think. But anyway, though now it's time to introduce Lisa Gibbs and invite her to join Pip on the stage. Lisa is a Professor of Public Health and Director of the Disaster Climate Adversity Unit in the Melbourne School of Population and Global Health, and Academic Lead for Community Resilience and Public Health in the Centre for Disaster Management and Public Safety. She's also our Prevention and Health Equity Academic Lead for the faculty's impact area. And as Pip has been telling us, Lisa's focused her work on disaster recovery and resilience, and particularly relating to the interplay between individual and community level outcomes. And these two have published together, as you've heard, and Lisa led the Beyond Bushfires study, so we're going to have a great conversation about that work and other things, and I'll invite Lisa up.
Thanks, Mike. And we can absolutely have a great chat. And I've been sitting there reminding myself this is not for my benefit, that it is for your benefit. So if we get caught up in it, just someone give me a bit of a nudge. But I will start with some questions of my own, and before we throw out to the audience. Pip, I obviously was delighted to hear you mention the Beyond Bushfires study, and particularly that you mentioned one of my favourite findings, which was about the importance of people in disaster-affected communities belonging to a local community group. And the reason it's one of my favourite findings is because it identifies such a simple intervention to support those groups and to justify recovery funding being focused, like being directed towards any sort of local community group. Which made me think, when you've been talking about students on campus, does that tell us that the student clubs have an ongoing relevance in terms of student belonging?
Yeah, thanks, Lisa. And I absolutely think they do. They're probably not the only thing we need to do, but they are, of course, absolutely vital. One of the issues I think that student organisations find is that the club activities are seen as fantastic and people engage greatly, but it's only a portion of the student body. So probably somewhere between a third and a half are actually getting engaged with clubs. So I think one of the challenges that we need to think about is how to build activities or programs that will actually reach more students. We saw, in so many of the studies, it's being embedded in a network that matters greatly, and that was also the case in the bushfires study. So I really think we need to think about that. So one of the things that I think several places have tried, and I think this is actually a really good strategy, is to also ensure that there's a really strong set of student clubs around the disciplines, because they're the ones that students who might not focus on, joining the tennis club or the dance club, they might actually participate in activities that are relevant to the area that they're studying. So I think we should be doing that, and we should be thinking about how to actually engage other clubs to help those clubs actually do some other things that are not about the discipline. For example, can sports clubs help them engage in a different kind of activity? So I do think those cross-cutting ties that you can create by seeding group collaborations are very helpful in building a strong student community. I also think we can probably, and I don't, it'd be great if there's any student organisation members in the room to hear from them, but I do think data is helpful in every aspect of life, and it would be great if there were, good systems for them to know which clubs are doing well, how to understand what interests students might have that are not being met by a current profile of clubs, those sorts of things. And in other words, ensuring there's good bottom-up contribution to the student clubs. And then I think sporting organisations are seeing this, that people are increasingly looking not so much for organised activity, there's a match at 10 o'clock every Saturday. They're looking for much more drop-in opportunities. They love to play the game, but they don't necessarily have the capacity to fit a more structured program of activity into their world. So ways of thinking about how, we as a university can encourage a little bit more of that more spontaneous pop-up activity.
Well, I feel like I should give a shout out to the Melbourne Uni Ski Club, because they are so good at throwing the net wide that they managed to attract my stepson from La Trobe Uni, Bundoora, who somehow managed to be a member here for 3 years and almost got elected to the committee. But I guess, there are also those socially strategic students that we can learn from.
We can indeed. They're our future politicians, of course. So they're the folks who bridge. They're the ones who build those all-important bridging ties, which can be used for personal advantage, of course. And there are many famous examples in history and business where that is how they have been used. But in a social context, people who bridge to other groups actually create the opportunity for connections amongst those groups who otherwise didn't interact. So they actually have a powerful effect on the building of a broader community network if things go right. Of course, the affordances need to be there, so there needs to be opportunity for meetings. So there's a lot of social and physical infrastructure that can help drive opportunities like that. So if the ski club happens to meet, near the time when some other club meets, there's more likely to be some interaction between them. So I think there are ways of, encouraging and helping people who've got those natural skills to actually help the community.
Well, I'm interested in hearing you say about the physical spaces and maybe bringing people together, because in the disaster space there's a real focus at the moment on social infrastructure, so the spaces and places where people meet and to enable the coming together. Although I must say I do know of one community where the public buildings were all burnt down, so they decided that rather than have these various small meeting places, they'd build a beautiful community centre that would bring people together. But we forget that not everybody gets along, and sometimes there's a reason those groups are meeting in different places. But yeah, do you think there's a consciousness on university campuses about those physical spaces or the gathering spaces? We certainly have some beautiful new spaces here.
Yes, I mean, there's been work going on in university spaces of just this kind, I think, for quite some time, which is fantastic to see. And the renovations of libraries and the development of spaces outdoors, distributed spaces where people can enjoy the environment and also work, a little power plug to stick your computer in if you want to, have a chat. Coffee shops around the place. I do think those things make a huge difference, and I do think people are getting better at designing those in ways that will encourage people to use them. In fact, I think many people now will set up sort of prototypes of what they're thinking to actually test whether or not they do have the intended effect of bringing people together and generating interaction. And that, of course, is a really helpful way to go. Again, having some data is very helpful.
Yeah, for sure. Well, what about you talked about multi-level networks. So I'm interested in whether student connections with staff, if that's important. Do we have data on that?
Yeah, well, yes, that there is much data on that now, and of course there's a huge focus on what people are terming relational pedagogies, which is all about creating relationships between staff and students that are warm but actually enable students to learn, help to build and foster peer connections in the class, and I think there's a real focus on those now, and for very good reason, because the evidence supports the value of those approaches.
Oh, fabulous. I just want to make sure I don't miss anything.
Just on that last issue, one thing I was going to mention, there's evidence also, and this comes very clearly through the qualitative studies on the students' belonging, that their everyday interactions with people who they might not meet very often are also seen as quite important and contribute to their sense of well-being on campus. So, every interaction with a professional staff member is important, and everything contributes. And indeed, there's some early work, I think, on interventions designed to encourage students to talk to strangers, and emerging evidence that can also generate well-being. People often have a reluctance to strike up a conversation with a stranger, but having the skill to do that, actually, you usually find people quite like talking to you, and people enjoy interaction, and so that's actually a really interesting and helpful thing to think about too.
Mm-hmm. And I guess, we're all conscious of the period during the lockdowns, the pandemic lockdowns, and this current generation of students missed out a lot on that social experience.
Yes, and there's a lot of research, I think, which has been, it's really only now sort of fully being analysed and published, but I think we've learned a lot about the adverse effects of cutting off the opportunities for social connection and physical social connection, not just online. Online doesn't quite cut it.
No. And which leads me to the question that there's so many changes, rapid changes we're seeing at the moment, social, environmental, technological. What are the implications of that? What's the what's next for universities in supporting student belonging?
Yes, well, of course, last week the study on racism at university campuses was released. I think we'll all be very busy looking at the implications of that. There's no reason to expect that racism is any more of an issue in universities than in other parts of Australian society, and indeed the Minister of Education said that last week. But I do think there's some really important things for us to think about there. What can we do to sort of try and address what is a broader societal issue? And I think the reason why I think we have to think very, very hard about it is that we have a unique opportunity. When students go to school, they tend to be in much more homogeneous environments, it's more localised. But of course, when they come to university, people come from all over Melbourne, all over the world, and the diversity of the community is just suddenly much greater. And so the skills to actually work productively, and there's so many positives to be gained by working productively with diverse others. All the research shows that, but if we can somehow actually provide opportunities for people to build those skills, that would be extraordinary, I think. But I do think that's going to be one of our next challenges. And the broader cohesion questions, we do, that there are issues over which people fundamentally agree, and again, the skills to sort of navigate difficult conversations with respect, but also with the possible outcome that there will be no consensus, that people will, at the end of the day, continue to hold different beliefs. We've got to work out how to give people, work out how to build those skills for ourselves as well, but we've got to also think about how we can, I think, improve everybody's capacity to deal with that.
Mm. Thanks, Pip. I feel like I am dominating. I'm really keen to hear any thoughts from the audience, and not sure if we have any students, but a shout out to any students who might like to put their ideas forward. So while people are thinking, I'll throw to Jodie. Do we have... No. Oh, brilliant, thank you. No, it's just here.
Thank you so much for the incredible oration and the amazing conversations and questions that have been asked so far. My question is, 2 weeks ago I attended another event called Wellbeing in Ukrainian Universities, these universities without walls where most of the education, if not all, is done online. And they talked about how well-being is more of an institutional responsibility rather than like an individual variable. And I just wanted to hear your thoughts on that. Thank you.
Thank you. That's a really wonderful question, and I really appreciate it. And there's two things I'd like to say. One is, of course, when Australian universities like Melbourne were established, and I worked at Sydney for a while, and this was absolutely true there, it was set up to offer lectures and run examinations. There was no consideration of the broader well-being of the students or staff who worked at the university. It was really very quite, although there was a higher purpose in learning, it was still quite instrumental in that sort of more personal sense. And I think societal expectations have changed radically around that, and I do think there is, I do think people expect institutions to actually create communities in which well-being is a priority. So, and I think we've seen the kind of people questioning the social license of universities. I actually think some of that is to do with the sort of, maybe we've been a bit slow to get to that point that we really do need to care deeply about the well-being of the entire community. trans students, and I do think we're starting to see that happen in Australia. Of course, in the Ukrainian situation, there's nothing like a crisis to really sort of focus the mind on what matters most. You'd have to think that was an important issue. In terms of, how do we do that? I do think there's, it's complex because we're large, complex organisations. I think there's a social connectedness aspect to it. I think there's a psychological aspect to it. All of the colleagues from the Contemplative Studies Centre here, that the work of that centre, for example, is one way in which some people can help or actually find a greater sense of well-being. Similarly, faith-based groups, or some people get it from sport, lots of, I think everybody's different, so having a diversity of opportunities, but also offering those opportunities in a way in which we understand, how effective we are, what we're missing. I think that's important as well.
I'm conscious that I turned away from Jodie, so I'll go back to Jodie before I go to others. Thanks, Jodie.
Thank you. And it's lovely to hear you, Pip, and I have had the great pleasure of working with Pip and Gary, probably more years ago than I care to remember. But the problem with infectious diseases is they're not like other emergencies, because connection improves your well-being, but it can also make you very sick.
Yeah.
And you were talking about the work that's been going on through COVID and other things, where clearly we employed a blunderbuss approach to reducing that connection harm while not maintaining the benefit. And are there strategies coming out sort of based on this sort of deeper network analysis that can help us to develop more nuanced strategies to preserve that mental health, wellbeing connection while mitigating risk?
Yeah, great question, Jodie, and thank you. Yes, I should have mentioned at the start that social connections aren't always good for you. Yes, definitely not. I think people are thinking about strategies to create less, more smaller groups of people who can interact without necessarily. That's the tricky thing. It's how do the groups connect that's the issue. So, there's definitely work going on. I haven't seen anything totally compelling yet, but I do think it's a good problem to think about. Of course, one of the most significant issues around COVID was people's workplaces and schools, of course, although schools quickly closed, but workplaces kept continuing, and thinking about ways of, voluntary codes, I guess, that allow people to interact more broadly, but with limitations on how broad that would be is probably the way to be thinking. But I do think it's very challenging because people are really very bad at following the rules.
We've got one up the back, and then we'll come to the front. I can see you both.
Thanks. So in terms of interventions to boost social connections and group belonging and this sort of thing, what about the humble pub? So, I think in our modern kind of way of thinking of things, we often focus more on the sort of negatives of alcohol and this sort of thing, which are very real, but there's also a lot of evidence that, these institutions of pubs and things, both at, universities and in the community generally, can have a really big effect on people's social belonging and can be like a linchpin of certain networks. And certainly in my own experience, many of my own formative experiences as a scientist were with, over drinks where I was a student. There was a mix of students at different levels and professors, and that ended up being a really valuable experience. So what about the role of that sort of thing?
Absolutely. All in moderation, of course. In fact, when I was at Sydney, we had a student club called the Rubik's Cube Society, but Rubik's Cubes only ever came out in the pub. So I do think there is absolutely a place for socialising, and in that sort of vertical way, but with people with very clearly shared interests around their work and focus. Incredibly helpful. And you can do it at morning tea as well, but you can do it in the pub, or you can have a sporting competition. There's lots of different ways of doing. I think they're all valuable. And the more they cut across the other forms of social organisation, the better, because then I think the more you get the benefit of growing additional connections around those, initial ones you form, either, at the pub or through some other group that some of those people belong to. Yep. Thanks for remembering the pub.
And if any of you are interested in social networks in disasters, disastrous drinks are held once a month at the Oxford Scholar. Kate, we've got two down the front here first, please, and then we'll go down to the back. Thanks.
Hi, thanks. I've been wondering a lot recently about individualism as a societal norm. And I'm also a parent with 2 school children. And what I observe in this cohort of parents is that they're very individualized and not really using social connection to help each other, in a way of okay, let's carpool, let's, hang after school together. They're kind of so in their own little bubble. I find it very, very hard to I don't know. My impression is they are so stressed out with their own little life, and so in this individualized mindset that they, I don't know, have no headspace maybe for social connection or something. I don't know what's going on there. Maybe you can explain that to me.
Yes, it's funny you should ask about that, because my children have been very involved in the running of a kindergarten, and for various reasons which I won't go into, I looked at the research on parent networks and the impact on their children. And actually there's some quite good Scandinavian studies which show that having a strongly connected, coordinated, interacting parent group is actually very good for the development of children. And I think that sort of just really underlines your point that it would be better if people were able to collaborate. And of course, it's partly up to the kindergarten in a way to establish opportunities for the parents to get together and build those social connections. So there's always a few steps away, but worth doing. Activate, take over the committee.
Pip, I'm really interested in the context of health professional programs where our students, compared to other students, spend a relatively small proportion of time on campus. And for the medical students in particular, they're rotating out to health service locations, and then within those health service locations, they're rotating around different units, different specialty groups. What does your research suggest to us in order to try and support those students who are moving to different areas, rural, outer metro, regional areas, and have short periods of time in which to build connections with the people they're working with?
Yes, it's a great question too. I actually think a strong network established in the early years amongst the students so that they get together regularly and discuss the challenges that they're having in that regard, because it is, as you say, it is very challenging to build new connections over and over and over and over again, but they will ultimately, I think, in fact, from what I know of cohorts of medical students, they build very strong friendships within the cohort, and so I think having opportunities to support those friendships on a sort of semi-regular basis through the whole course, especially while they're doing those things. Some of it could be online, but some of it face-to-face would be very, very helpful. No, I don't. But my intuition is it wouldn't need to be that much.
I tried to argue for 2 more questions. I'm only allowed 1, and I promised. Did you still want to have a question? I think you were next. Everybody's pointing at other people very generously. Apologies, Gary. I know you wanted one.
That's a network thing.
Should I ask my question or not?
Just go really quickly, and then I'm going to disobey Kate and bring the microphone
Thank
down
you
to the
very
front.
much for your fantastic presentation. I was wondering, in your networks and the association, where does social media fit into your networks? Are they a bigger bubble in a different colour, over, under, beneath, or inclusive of the networks? The good and the bad could perhaps be sorted as children have suddenly not been allowed to have the social media. Is that good or bad for the networks?
Yes, social media, it's a big question, Graham, thank you. They're both a means and a node in their own right these days as well, so they actually complicate the picture quite significantly. And there's a lot of research on social media. There's good social media and bad social media. In general, where people interact with social media, it's the results are much more, or the sense is it's a much more positive experience for individuals. Where they're sort of more passive observers, less so. But that's it's a complicated literature, and I don't know it well enough to sort of give you the ins and outs of it. But in terms of the sort of social networks that we study, it's certainly a means of, it's a kind of a tie really, interact on social media. But it's not, it's just one part of the picture, and probably the interactions are that matter. Many of them are sort of outside of social media, but some of them will be inside social media, and that's another whole sort of set of things to explore.
Okay.
Don't know if that answers your question.
This is the very last question, but yes, so thanks, Kate. Was that right?
Thank you very much. I feel like you've looked inside my mind, Pip. I've just been having this amazing conversation today with Julietta about the very same issues, so I really thank you so much for that. But I actually want to ask you about the aftermath of the bushfires. So, I worked across the ranges during that time, supporting people, and it was obviously a very challenging time. And so there were some networks set up in that time, and some of them were quite effective. But I've heard in later years that a lot of them have fallen away. So I wonder if you have any thoughts on that.
Yes.
How do you maintain?
Yes, no, it's a great question. Lisa might know more about this than I do, but one of the initial reasons we were interested in social connections in bushfires was from a conversation with clinical psychologists who had often spent time with people who'd experienced trauma, and their observation was that there was a very significant change in people's social networks. They almost completely turned over, so old relationships fell away and new ones were built. And that sometimes it was because people moved away, but there was something sort of quite significant happening with the dissolution of social connections in response to the trauma. And I think we saw a little bit of that. I didn't go into the detail in the PTSD findings from our study. But yes, I think it's probably quite hard to build new connections when you're experiencing the outcome of trauma. So that might be why efforts to build connections didn't always land well. Yes, interesting, and I'd love to know more about that too. There's no doubt that over time those initial connections will fade because relationships are changing all the time. They're dynamic qualities. But I'd like to think there's some residue of kind of learning from that might make it easier to form a different connection next time around. But I don't know that we've got great data on that.
Thank you, Pip. Clearly I'm not the only one who wants to talk to you all night. So we can all elbow each other out of the way when we gather. Mike, are you coming back or...?
Just thank you all for coming this evening. Thank you, Lisa, for curating that great conversation. And a big thanks to our Priscilla Kincaid-Smith Orator, Professor Pip Pattison, for her discussion this evening. Thank you for leaving the equations out. I'm sure it's all backed by hardcore mathematics, but it was a very rich conversation. I think everyone enjoyed. We've even got an evidence base to keep PAs open, I think. So we'll all go into the night with a smile on our face for that reason. And you're all invited to join us. I think we're doing next door, is that right, Kate? Yep, next door in the library area for some drinks and nibbles. So thank you.